The Secretary of Health and Human Services dismisses an entire vaccine advisory panel. The House passes a funding rescissions package, and details begin to be released in the Senate regarding the Republican budget reconciliation bill. For the week of June 16th, 2025, from Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
Everyone, we are making great progress on our Republican reconciliation bill that will lead to a stronger and safer America. And those two are intertwined because
kicking off this week's episode with news from Capitol Hill, where the Senate continued its consideration of the GOP's budget reconciliation package last week. The Health, Education, Labor, and Pensions, or HELP Committee, released its portion of the legislative text on Tuesday, which primarily focuses on student loans, but also included a few health proposals related to Affordable Care Act subsidies and health plan abortion coverage. Legislative text from the Finance Committee in the Senate has not yet been released, but will contain the bill's remaining health-related provisions, including any proposed changes to the version of the bill passed by the House of Representatives last month. Efforts are ongoing to ensure the One Big Beautiful Bill Act has enough support for passage and complies with the Byrd Rule and the Chamber's requirements for budget reconciliation. Floor consideration is expected to begin in the Senate on the week of June 23rd, with the goal of enacting the bill before July 4th. It was reported last week that HELP Committee Chairman Bill Cassidy, a Republican physician from Louisiana, is circulating a measure that would codify a most favored nation adjacent policy for inclusion in the budget reconciliation package. Cassidy's proposal would allow the Medicare program to claw back money from pharmaceutical manufacturers that sell their products to other wealthy nations at a price lower than is available in the United States. The policy would apply to the 50 drugs that cost Medicare the most money, to be evaluated every 3 years. The amount of money recouped would be based on the gross domestic product of other countries, those with a nominal GDP that is not less than 3% of the U.S. It remains unclear how much support Cassidy has garnered for his bill. 38 House Republicans led by Budget Committee Vice Chairman Lloyd Smucker from Pennsylvania sent a letter last week to Senate Majority Leader John Thune, stating that any additional tax cuts added to the reconciliation bill by the Senate, quote, must be matched dollar for dollar by real, enforceable spending reductions, unquote. The letter warns against the use of budget gimmicks and accounting tactics like timing shifts to reduce the cost of the package. Republicans can only lose 3 votes in either chamber and still pass the bill along party lines. House Republicans finalized and adopted revisions to the reconciliation legislation last week to keep the legislation in compliance with the Senate's rules for budget reconciliation. The changes were passed in a mostly party-line 213 to 207 vote on Wednesday. They do not impact the health-related provisions of the measure.
Time overdue. We just had an important vote here on the floor. Today's passage of this initial rescissions package marks a critical step towards a more responsible and transparent government that puts the interest of the American taxpayers first. We want to thank DOGE for their...
Last week, the House of Representatives cleared the White House's $9.4 billion rescissions request in a 214 to 212 vote. Republicans Brian Fitzpatrick of Pennsylvania and Mark Amity of Nevada, Mike Turner of Ohio, and Nicole Malliotakis of New York voted against the bill. The rescissions package includes $900 million in previously approved congressional funding for global health programs. The bill would reduce funding for the President's Emergency Plan for AIDS Relief, or PEPFAR, in addition to cuts to other HIV/AIDS, family planning, and reproductive health initiatives. The legislation will now be sent to the Senate for consideration, where it will only require a simple majority vote for passage. Several Republican senators have raised concerns about the cut to PEPFAR, prompting conversations on Capitol Hill about the complicated process for amending the rescissions request. Congress must act on the request within 45 days before the administration would be required to spend the funds.
Control trial. And that is just malpractice. So the people who were in charge of that are now gone. And we're going to bring people onto the ACIP panel, not anti-vaxxers. We're bringing people on who are credentialed scientists, who are highly credentialed physicians, who are going to do evidence-based medicine, who are going to be objective, and who are going to follow the science and make critical public health determinations for our children.
That was the U.S. Department of Health and Human Services Secretary Robert F. Kennedy, Jr., who last week fired all 17 members of the Advisory Committee on Immunization Practices, or ACIP. ACIP is an independent panel responsible for advising the Centers for Disease Control and Prevention on vaccines and making recommendations that determine insurance coverage of the shots. It's generally regarded as the most influential of the 4 external government bodies that advise federal agencies on vaccine policy. In an op-ed published in the Wall Street Journal, Kennedy said, quote, "A clean sweep is needed to reestablish public confidence in vaccine science," unquote. The HHS secretary has long accused ACIP members of having conflicts of interest and being too influenced by industry, but he pledged to maintain the panel without changes during his confirmation process to secure the vote of Senator Bill Cassidy, a Republican physician from Louisiana. Cassidy said, quote, "Of course, now the fear is that ACIP will be filled up with people who know nothing about vaccines except suspicion," unquote, stating that he would continue to talk with Secretary Kennedy to ensure that this is not the case. Cassidy later clarified that the previous assurance he had received from Kennedy was related to the ACIP process rather than who sits on the panel. ACIP members, who are appointed to 4-year terms, meet 3 times a year to review data on vaccines and vote on updates to the CDC's vaccine schedule. While the CDC director has the authority to overrule ACIP recommendations, such occurrence is rare. ACIP is next scheduled to meet on June 25th through 27th. An HHS spokesperson stated that the meeting will continue as scheduled with new membership. Kennedy has pledged to bring in highly credentialed physicians and not anti-vaxxers to fill the committee. He has so far announced the names of 8 new ACIP members. Concerns have been raised that the reconstituted panel already includes several vaccine critics, including people who have specifically questioned the safety of mRNA vaccines and the childhood vaccine schedule, more broadly. Back to the Senate today, where Finance Committee member Chuck Grassley, a Republican from Iowa, and Committee Ranking Member Ron Wyden, a Democrat from Oregon, released a report titled Operation Transplant, examining the need for oversight in the organ donation system. The report addresses 2 issues of long-standing concern to the committee related to the recovery of pancreata for research, which is counted toward an organ procurement organization's recertification, and the amount of oversight and transparency over conflicts of interest among OPO leaders and governing board members. The report details an 850% increase in the total number of pancreata recovered for research without reports of a clear corresponding research benefit, and recommends that the Centers for Medicare and Medicaid Services further clarify the requirements and expectations of OPOs reporting pancreata to be counted toward certification or recertification. Regarding CMS's conflicts of interest policy, the lawmakers suggest that the agency further clarify the requirements and expectations of OPOs to make clear that OPO governing boards and medical advisory boards, as well as CMS surveyors, should monitor actual and potential conflicts of interest.
To all our members, especially Ranking Member Thompson, thank you for your cooperation leading up to today's markup. I'm encouraged by the work we did to get to this point, and I'm confident at the end of the day, every member of this committee...
Representative Mark Green, a Republican physician from Tennessee and chair of the House Homeland Security Committee, plans to resign from Congress. He announced last week that he has accepted a position in the private sector. Green notified Republican leadership that he would vacate his seat after the next vote on the budget reconciliation package in the House of Representatives. Upon Green's resignation, the chamber will have 219 Republicans and 212 Democrats. Tennessee Governor Bill Lee, also a Republican, is required to order a special election within 10 days of Green's resignation, set a date for primary elections to occur within 55 to 60 days, and schedule a general election to take place within 100 to 107 days. Winding down today where Jim O'Neill was sworn in as Deputy Secretary of the U.S. Department of Health and Human Services last week. O'Neill served at HHS during the George W. Bush administration and is the former CEO of the Thiel Foundation. As the second in command at HHS, O'Neill will be responsible for managing the department's day-to-day operations. The Senate is scheduled to vote on the nomination of Gary Andres to serve as Assistant Secretary of Health and Human Services on Monday. Final news today, where the Medicaid and Chip Payment and Access Committee, or MACPAC, released its June report to Congress last week. MACPAC's latest report makes recommendations on transitions from pediatric to adult care for Medicaid-covered children and youth with special health care needs, considers appropriate access to residential behavioral health treatment services for children, describes findings from the Commission's analytic work on access to medications for opioid use disorder and Medicaid, provides an overview on the program of all-inclusive care for the elderly, and looks at self-direction for Medicaid, home, and community-based services. We end each week's episode with a call to order, where we lightning round congressional meetings and hearings in the near future that you need to know about. First, on Monday, July 21st at 5 p.m., the House Appropriations Subcommittee on Labor, Health and Human Services, Education, and Related Agencies convenes a markup of their fiscal year 2026 appropriations bill. And last, on Thursday, July 24th at 10 a.m., the House Appropriations Committee hosts a full committee markup of their fiscal year 2026 Labor, Health and Human Services, Education, and Related Agencies bill. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.